This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today about the state of population health management. We're talking with Matt Hanley, a former emergency medicine physician who played executive leadership roles, both operational and clinical, at Atrium Health and SSM Health before joining Navis, a leader in population health that helps delivery systems, health plans, and physicians organizations both transform and move to value-based care. Navis is currently managing more than 4.5 million value-based care lives with its various partners. Now, Matt is an ideal person to discuss this topic with because I know he believes that this is the right direction for healthcare. But he is seeing the opportunities as well as the challenges in a lot of organizations around the country as they move down this road, not just the one or two organizations that most of us have perspective on. And his feet are on the ground based on his time at SSM and Atrium and now at Navis. His feet are on the ground because he has seen the failures of population health management show up in the emergency department as he works as a clinician. Now, Matt, I know you are quite familiar with the duress provider organizations are under right now. At least some of them are saying they have to get back to basics. And that might mean doing fee for service really well and in really high volumes. And many of them are saying they can't be distracted by anything else. What are you seeing around the country now in this regard?
Well, thank you, Tom. And let me begin by saying it's just a delight to be with you today. And I'll also start by saying that before I even answer that question, I want to say that it's an incredibly exciting time to be in healthcare. It is, in my entire career, both more complex and more challenging than I've ever seen it. And what that means is that there's more opportunities than ever for us to tackle this problem that we're trying to solve. I think if we take a minute to comment on the moment that we're in, it can help answer the question. I think we're at a moment of inflection in our journey with regard to transformation of population health, and it's maybe the next big inflection in healthcare. And in my mind, it's characterized by four different features. The first is that the economic headwinds that provider organizations are experiencing are of a different magnitude than they've been seen before. So it's more than about just running the business well. What they've realized is that the old playbook isn't working. And what we're seeing is blue chip organizations, household names who are starting to suffer economic consequences like tripping bond covenants. The second thing I'd mention is that value-based care, care transformation, payment care transformation is no longer an interesting feature on strategy playbooks for provider organizations. And last time I checked, which was this morning actually, within the Medicare population, we're at 49% of all Medicare enrollees are in a Medicare Advantage plan. So we're almost over halfway there. The third thing I would mention, Tom, is that those who are figuring out how to engage the minds and hearts of the physicians and the clinicians in this journey, in this population health journey, and doing it with them and not to them, are the ones who are starting to find success. And I know there's a lot of activity in the physician community out there in terms of acquisition models. And to be honest with you, I think we're only at version 1.0 in that space. And then the last comment I'll make is that I think people are realizing that the success of the incumbent organizations, and in particular the provider organizations, are going to be absolutely critical on this journey. And the reason I say that is because if you look across the United States, the bulk of our care is still delivered by them in our communities. So while they may be inefficient and while they may be criticized as being expensive, they are necessary. And I think the rate of transformation in the US is going to correlate to the rate of transformation of these incumbent organizations. And so I would say all that to say, Tom, is that while many organizations are certainly doubling down on some of their old fee-for-service behaviors, they're also saying in the same breath that there has to be something fundamentally different about us moving forward, and that is transformation to value-based care.
Well, let's talk about how organizations should think about that difficult question of plunging in. First the external and then the internal factors. As leaders look at their market context, what should they pay most attention to?
Sure. Well, the old adage that healthcare is different and healthcare is local, I think, is absolutely true. I've had the blessing of seeing many different markets, and so I think there are a lot of different features that I would pay attention to externally. And first of all, is you really have to take stock of where you are in your market. And I think there are three things that I would immediately go to. First is I want to understand what the payers are doing in the market. So I want to understand which payers are in my market, which lines of business, which populations they're covering. I want to know who they're partnering with, and I want to know how and why they're partnering with. I also want to understand where they are in their risk journey. And what type of risk arrangements or partnerships they may have in place with other folks in the market. I think a lot of people maybe underestimate how motivated, and I think there are many payers who are equally motivated as providers to figure out this value-based care thing, because they realize that in order to be relevant in the future, that payment transformation in and of itself is not sufficient for us to solve the problem, and they need strong, deep partnership with the providers to get it done. The second thing is I want to understand the populations and the networks within your community. So, the name of the game in population health is taking care of populations. And so what populations are present in your community, and who are these patients, and who are the providers taking care of these patients? And are they attributed, or are they, or have they not been attributed to those providers? The third thing, and Tom, this is one of the most important things, is understanding that clinical space and understanding the alignment of the physician community. So whether they're employed by the provider systems, whether they're aligned and how they're aligned, are they in networks, clinically integrated networks? And I'm not only talking about the primary care, because I think primary care is certainly a bedrock of population health. I think people are waking up to the idea of the criticality of that specialist component in the full care continuum. So I want to understand them. And then certainly last, I want to understand which, I call them the disruptors. Which disruptors have entered that market, and what does that footprint look like?
Well, let's turn to the second set of factors, the internal factors. So as leaders look at their own organizations, what should they be assessing as they weigh whether to plunge in?
Yeah, thanks, Tom. I like to think about this heart, mind, and body. So I like to, start with the heart. I think for organizations, if they're committed to moving in this direction, they have to start they have to fall in love with the problem. They have to have passion for the problem that they're solving. And that has to be the fire that frankly burns underneath them as they go on this journey. And so it really requires some bold and courageous transformational thinking. And I like to say that incrementalism is not transformation. The second is you need to have leadership commitment, and that's not only at the CEO level. This is at the board level. And I would tell you from my experience that the smallest chink in the armor, or the smallest crack of light in that level of commitment, will undermine your journey. The third thing is, when I talk about body, that's really about the core competencies and the enabling structures that really need to be in place for you to go on that journey. So the first is the most important enabling feature is governance. And then I would say there are at least, in my mind, 10 potential domains around population health that are critical for you to understand where you are and your readiness to go on the journey. So things like, I would mention data. You have to understand what data you have, what technology do you have to support the population health journey. Analytics is critical. Analytics is critical to create the transparency for you to understand your current state. And not only your current state, but the potential value that you can unlock by moving in the direction of population health. Reporting things like your staffing arrangements with care management, how you're organized to do things like throughput within your acute care facilities or to your post-acute care facilities, how you've optimized your clinics. What's your payer contracting and your managed care contracting setup look like? Do you have core competencies in really being, understanding how to pace and sequence your contracts and unlock value as you go down this path? And so all those things that I mentioned and more are part of the assessment, I would say, Tom, that you need to do. And then to understand how they all interplay together, because they can't all work in their individual silos. There has to be a line of sight of how well they're integrated.
Well, you've been touching on these themes, but to make it crystal clear, without naming names, can you describe the characteristics of an organization that is completely ready to plunge in, if there is one?
Thanks, Tom. I'm not sure anyone's ever completely ready for full transformation, but there are a couple features that I think are critical when I look at organizations and their readiness. The first feature that I have seen is organizations that have a very high collaborative IQ. And the reason for that is that many of these organizations will understand that in order for us to achieve the speed we need, that we're most likely going to need to partner with someone. And so the ability for an organization to partner with others to go on this journey and to figure out who has right of way, to figure out how to break down silos is critical. The second is the leadership commitment that I've already described, and it's hard to overemphasize how absolutely critical that is. The third is it's actually, frankly, really nice if they've had some experience in value-based care or population health already. And there's two reasons for that. One, I do think there is a level of critical mass that makes it worthwhile to start. And I don't have any science behind it, but based on my experience, I think it takes at least about 25,000 either ACO commercialize with an eye of getting to 50,000 to start, or you can have 2,000 Medicare Advantage lives with line of sight to getting to at least 4,000. And to me, those are minimal viable criteria to start. And the second reason that I like to see organizations have some experience in value-based care is because if they've actually put their foot in the water and they've tried it, they start to appreciate how darn hard the journey is going to be and the complexity that is present in order for them to be successful, and that to me it helps them double down on the commitment to get there. The last critical factor, Tom, is having an incredibly well thought out roadmap that helps them navigate what the path would potentially look like for the next 3 to 5 years. And when I talk about roadmap, I'm talking about, frankly, a roadmap that is undergirded by a really robust economic model that models in all those factors that I mentioned before that help the organization understand what needs to be true at certain points of their journey for them to be successful in population health. So for an example, what needs to be true about my technology platform and analytics in year one? What needs to be true about my physician or clinician enterprise in year two? Do I have to have a compensation model in place? Do I have to have alignment, with this physician group? Do I have to have these care models set up, and so on and so forth? And those folks who have, frankly, spent the time to do that type of due diligence, to me, have done the first, body of work necessary to go on the path.
Okay, so what's it look like at the other end of the spectrum? What's an organization that is really not ready look like?
Yeah, I think the simple answer is the opposite of just what I said. So the lack of the leadership commitment, lack of value-based care experience, or frankly, a critical number of lives, maybe lack of some of the core competencies or core capabilities within their organization. But I think the other big reason that people are not going down that path is, to be frank, Tom, there are still some markets in the United States who are predominantly fee for service. And those tend to be areas of really, really strong economic growth, tend to be areas where the demographics are on the younger side and in terms of the populations. And so there are organizations who are still doing, frankly, fairly well in that space and growing.
Well, assuming most organizations are somewhere in between these two extremes, and if you were back in your old jobs as an executive in a delivery system, how would you approach this work?
Yeah, thanks, Tom. I think that's a really good question because I think that's, honestly where most organizations sit is somewhere in between. And I think, it goes back to what I said is, establishing the leadership committee, having a really good sense of understanding your current core capabilities, and what are the gaps between that and what an ideal state would be, and then setting up, putting in place a roadmap that is supported by an economic glide path, and then frankly just starting. And part of this journey that we're all taking in population health is a learning journey. And as we started in the beginning, I'm a huge proponent of this because I believe at the end of the day, it is, frankly, the way that we're going to realize the quadruple aim. Because I do think if we're able to reduce the costs, if we're able to improve the access and the quality, I have seen tremendous engagement and satisfaction by patients, and frankly, I've seen incredible engagement and satisfaction by our providers.
Well, Matt, I want to thank you so much. I have to say, you've combined three great ingredients in what I think are really valuable remarks. First, you've got the tough-minded assessment of an emergency medicine doc. You can see that when blue chip organizations are not meeting their bond covenants, that's a really bad prognostic sign. And if you try to ignore it, you're in real trouble. You've got idealism, like you actually really do believe this is the right thing, and the importance of passion in leaders for doing what will be the right thing for their organization for healthcare. And then the third thing is you got a framework for how to approach these issues. That it's not about just giving inspirational speeches, but it's getting organized and getting down to work. And so I think that the framework that you offer in your remarks is going to be valuable for a lot of folks as they go down this path. So I know that we're going to be tapping into you more often in the future, and I really thank you for coming today and sharing this much with our audience.
Thank you, Tom. My pleasure.